Hello everyone, I'm Donna Bush with your CIG TV News Update. We begin with news on how the MRCU and the Public Health Department were able to combat an outbreak of Chikungunya when the first case was confirmed last June. We hear the details now in this report.
In the Cayman Islands, we had the first case in June, and thereafter slowly the numbers, that was a case imported from a traveler that returned from Dominican Republic. Later on, we had many other cases. Out of a total of 44 confirmed cases in 2014, of whom 28 has travel history to other countries, that means it's imported, and only 16 locally acquired cases. Of course, this is not the end of it. There have been about another 25 or 30 who have traveled to other countries and came back, but we have not tested all of them. And all the local cases we have tested, so we can say that only 16 locally transmitted cases. Since the beginning of this year, we have about 22 we have tested. So far, no dengue or no chikungunya in the Cayman Islands. So we can conclusively say we have ended our outbreak in December 2014, and with the help of the MRCU and also the public cooperation in eliminating the breeding sites and also protecting from mosquito bites, we are able to control it.
We were also aware that the mosquito concerned here in Cayman is highly resistant to the typical types of insecticides that would be used. That was we knew that from a research program conducted here in Cayman. So we were able to switch the machines, switch the insecticide as appropriate in order to target that mosquito. That was a very valuable piece of information that we had. What we did was actually a number of different things. We chose not to focus so much on the larvae. It's the immature stages of the mosquitoes that live in water, the wigwags. We instead focused more on the adults, what people think of as mosquitoes, the ones that bite you, because we were looking to break the transmission cycle, trying to kill the adults before disease can spread. So we were able to carry out aerial treatments, and this was done at a different time from the normal mosquito spraying because this mosquito has a different activity period. We used fogging machines, and we also used handheld fogging machines. This is very intensive, what's called thermal fogging. So we were able to, with the aircraft, treat a district. With the fogging machines, we might do a residential area. And with the handheld fogging, we could do several houses, several yards at a time. Very intensive. So those three things combined in different formats was one of the keys to the success. We did continue ongoing control features as normal in the background, but this was the main focus. I think one of the key strategies in all of this is that we were able to get from Public Health Department information on suspected cases, and we got that information right away. We didn't get patient details like the name and so on, but we did get an address. So what we did was rapid response, and I think this rapid response is important. We were able, as soon as we got information on a suspected case, or more usually several suspected cases at one time, we would not wait for the results to come back from laboratory confirmation from overseas. We would launch a response immediately. So we could target one specific area, again, and that might be by aircraft or ground fogging machine or handheld machine or a combination of all three. So that rapid response, I think, certainly was important.
And of course, we will continue to update the public on any future outbreaks or information sent out concerning the chikungunya virus. Meantime, the NRA recently started new roadworks with paving the off-road by the Strand Plaza on West Bay Road, and motorists may have noticed that the National Roads Authority has started some prep work on reconstructing Godfrey Nixon Way from the Butterfield Roundabout through to the Eastern Avenue intersection. And for the convenience of road users, the NRA and the Ministry of Infrastructure have put together a timeline on the roadworks from this Friday, the 10th to the 17th of April. CUC will be relocating existing light poles to make way for drainage installation. The week of April 19th, a new sidewalk and curbing will be installed. Officials say work on the project will be completed by April 30th. They're asking drivers to be very careful while driving in the area, although they note that some night work will take place. NRA Director Paul Parchman is asking the public for its patience while the roadworks continue. Well, the Ministry and Department of Tourism have taken on 2 new agencies to represent the Cayman Islands in the United States. The final 2 were selected after a rigorous open competitive tender process, with some 20 companies vying for the contracts.
Assuming the public relations services role will be Coin PR, based in New Jersey. The award-winning agency was founded in 1991 and has worked with clients such as the Walt Disney Company, Daytona International Speedway, and a myriad of other clients in fields such as hospitality, sports, travel, and tourism. The role of creative services will now be managed by Bright Red TBWA, based in Tallahassee, Florida. Founded in 1987, the agency has received such awards as Adweek's Agency of the Year. Amongst other awards, the agency will manage the way forward for the creative design elements associated with the Cayman Islands brand.
Well, Bright Red TBWA and Coin PR agencies will be working closely together under the supervision and guidance of the Department of Tourism to creatively impact elevated visitation and brand awareness in the U.S. market. The agencies will also move forward the Caymankind brand positioning to its next phase, deepening the impact of the unique selling proposition with core audiences. Both agencies will begin their tenure on May the 1st. Well, this information for those wanting to know more about sickle cell. A support group meeting is set to take place on Tuesday, April 14th. That's at 7:30 p.m. at the Public Health Waiting Room. Dr. Anna Matthews will lead the discussion. All interested persons are encouraged to go, and you can get additional information by calling the genetics coordinator at on the phone at 244-2630. That's 244-2630. As always, if you missed our news update, you can get all the details on our Facebook page and our YouTube channel. Also, don't forget to tune into Radio Cayman's talk shows. That's For the Record and Talk Today. That's on weekdays and week mornings. For now, I'm Donna Bush, as always, thanking you for joining us, wishing you a wonderful and, of course, a very safe weekend. And I invite you to join me back here again on Monday evening. Until then, bye-bye for now.